or trying to treat cancer, I will use thymosin alpha. But if I have too much of Th17 and Th1, then I'm looking for something else that will move the polarized immune system to Treg or to Th2 and have the Th1 and 17. I will use thymosin beta. So if I'm treating autoimmune diseases like systemic lupus erythematosus or rheumatoid arthritis, which they have too much of Th1, Th17, I use thymosin beta. And so understanding the language of the immunology, it gives us better understanding of how to manage chronic disease in general. Because any chronic disease out there, you will see an imbalance in the immune system, and you can investigate the imbalance, find out where it's moving, and you start working on restoring it. And generally, you can restore the balance of the immune system by using polyphenols and flavonoid and all the integrative approach and fixing the microbiome. That helps to restore the whole thing back to normal. But thymosin alpha and beta, they do even more. They polarize the immune system. So if I'm trying to treat cancer, I want to move it more to Th1. If I want to treat COVID-19, I want to move it more to Th1. And so I will use thymosin alpha. You got my point?
Yes. Okay.
Any questions?
Anybody else have any questions? We want to thank you all again for joining us weekly here. Dr. Halasa, that was a fabulous talk, and now we'll need next week for you to translate it for us.
Well, on Thursday, I'm going to present.
Thursday, you're going to translate it for us.
So they can come to my event on Thursday, 7:30 p.m.
Okay.
And I will share with you and then from here to Thursday, please do your homework and come up with questions. Let's scrutinize everything. I like people to scrutinize, to grill, to challenge, because this is how it is. This is more of what we call review, right? Peer review. And we need this scrutiny and this challenging and this questions so we can validate the information that we are learning. And also we need to use it in our clinic, how we can translate this in the clinic, what we will do to benefit clinically, because the whole purpose is translating what we learn from the researches into clinical, and that's what I'm doing. It's called translation research. But we need all of your contribution, participation, involvement, and bring your cases so we can discuss them and bring those new languages, things that we learn into more clinical work.
It takes a time or two to get this under your belt. Very good.
Okay. I can have my my board members hang out for a couple of minutes. We need to talk a little.
Is there any question in the text? Did you see text questions? Because I see a lot of chat and text. Maybe they have questions. They don't want to talk and they want to
Okay.
text.
Go ahead.
I mean, can you go and throw them and see if there's anybody has question, Dr. William?
I can see it, Doctor. Yeah, there's not that much in there. There's a.
Okay.
Okay. To balance ANS and vagus nerve, fermented ginseng is essentially efficacious. This is from David Kahn. And he said he would prepare the studies. Prepare a lecture for us, David.
Yeah.
Right, because ginseng is nitric oxide donor, right? We know the nitric oxide stimulate the sympathetic tone. In other words, inhibit the sympathetic tone, right? Because it puts the brake on sympathetic tone, while it stimulates the parasympathetic. Nitric oxide stimulate the parasympathetic, inhibit the sympathetic. Ginseng is nitric oxide donor. It's a supplement that decreases nitric oxide. It's good for erectile dysfunction as well. So I agree with you. Yes.
It's a fascinating substance.
Right. Yes, it does help in erectile dysfunction. Yes, they're giving it for that because it's a nitric oxide supplement. Yeah. Any other questions? Okay, so Thursday we have it again. We're going to repeat all of this. From here to Thursday, I'm expecting doctors, you're going to grill me. I like grilling, okay? I like even barbecue grilled. I don't like it fried. So please grill me as much as you can.
Okay. Dr. Burgess, Dr. Kent, hang out just for a minute or two.
Good night. Thank you, Dr. Clearfield, for all your.
Thank
Thank
you.
Thank you, everybody.
Okay,
What an
thank you
amazing
very much.
lecture.
You're
Thank
the
you,
host, so
Doctor.
you can close the room.
Good job,
care.
guys. Thank
Dr.
you.
Halasa,
Good
thank
night.
you so much.